Welcome to the Bloodborne Pathogens Training. Produced by Jan and Bev's Home Care for Personal Care Aid in Service Training. After you complete this training, you will be able to identify harmful organisms that may be present in blood, exercise precautions to prevent the spread of bloodborne diseases, know what to do if you are exposed to blood or body fluids, and understand the importance of vaccination against hepatitis B. Why is it important to protect yourself from contact with blood and body fluids? Though they can't be seen, there are hundreds of tiny organisms living in blood and other body fluids that can cause disease in humans. These are called bloodborne pathogens. Some of these organisms are harmless and can be handled easily by the body's immune system. But others can cause severe illness, such as hepatitis or AIDS. Let's review some of the more severe bloodborne pathogens. These include the hepatitis B virus, or HBV, the hepatitis C virus, or HCV, and the human immunodeficiency virus, or HIV, that causes autoimmune deficiency syndrome, or AIDS, and others. These pathogens are transmitted through contact with infected body fluids such as blood, semen, and vaginal secretions. Exposures can occur when the skin is punctured by a contaminated needle, razor, or other sharp item, or when broken skin or mucous membranes are splashed with blood or body fluid. Fortunately, most exposures do not lead to infections. Standard precautions are designed to prevent transmission of HIV, HBV, and HCV. Standard precautions must be observed in all situations where there is potential for contact with blood or other potentially infectious body fluids. You should treat all human blood and body fluids as if they are infectious. The first standard precaution is proper hand washing. When hand washing facilities are not available, use an agency-approved antiseptic hand cleaner or an antiseptic towelette. As soon as possible, rewash your hands with soap and water following the correct hand washing procedure. Please complete the separate training, Hand Hygiene, to learn more about the proper hand washing procedure. The second standard precaution is gloves. Use gloves in all situations where you may come into contact with blood or body fluids. Use gloves for client care involving contact with mucous membranes, such as brushing teeth. Change gloves and wash hands between client contacts. Use gloves when you have scrapes, scratches, or chapped skin. Do not wash or disinfect gloves for reuse. The third standard precaution is protective barriers. Protective barriers, including gloves, reduce the risk of your skin or mucous membranes being exposed to potentially infectious blood or body fluids. You should wear the appropriate barriers for the work you are doing. We provide suitable personal protective equipment, or PPE, in a variety of sizes. This includes gloves, gowns, masks, eye protection, face shields, and other things. Hypoallergenic gloves, glove liners, powderless gloves, or other alternatives will be made available for those who are allergic to regular gloves. Please inform your supervisor if this is the case. The protective barriers you need depends on your work. When splashing of blood or body fluids is likely, wear a mask if your face could be splashed, eye protection if your eyes could be splashed, and a gown if your clothing or skin could be splashed, in addition to gloves. The fourth standard precaution is the proper disposal of sharp items. A sharp is any object that can penetrate the skin, such as needles, scalpels, broken glass, and even exposed ends of wires. A sharp is contaminated if it has been in contact with blood, body fluids, or body tissues. Contaminated sharps must be disposed of properly. Be careful to prevent injuries from needle sticks and other sharp instruments after use and when disposing of them. Never recap or manipulate needles. If it is absolutely necessary to recap a needle, use one hand to slide the needle into a cap lying on a flat surface. Do not hold the cap in your hand while recapping. In addition to these four standard precautions, hand washing, gloves, protective barriers, and proper disposal of sharps, you should wear thick rubber household gloves to protect your hands during housekeeping tasks or when cleaning anything involving potential blood contact. All linens soiled with blood or body fluids should be treated as potentially infectious. Surfaces that have been contaminated with blood or body fluids should be cleaned with a disinfectant. If you are exposed to blood or body fluids, immediately wash needle sticks and cuts with soap and water. If you are splashed with blood or body fluids, immediately flush the area with water, for example, nose, mouth, or skin. If your eyes get splashed with blood or body fluids, immediately irrigate them with clean water, saline, or a sterile irrigant. Next, report the exposure at once. Treatment may be recommended, and it should be started as soon as possible. See a medical professional. Discuss the possible risks and the need for treatment with the person managing your exposure. Remember that mandatory testing of a client is not legal. Clients who might be a source of an infection must give consent to be tested. Needle sticks are the most common cause of work-related HIV infections. Risk factors include the amount of blood or fluid, the puncture depth, and the disease stage of the infected person. The average risk of HIV infections after a needle stick or cut exposure is 1 in 300. The risk after exposure through the eye, skin, or mouth is less than 1 in 1,000. There is no vaccine against HIV. Post-exposure treatment is not always recommended. A physician or exposure expert should advise you. Drugs used to prevent infection may have serious side effects. You should have HIV antibody testing for at least 6 months after exposure. There is a vaccine to prevent hepatitis B. Those who have received the vaccine and have developed immunity to hepatitis B are at virtually no risk for infection. The vaccine requires a series of 3 injections. The first, initial, injection. The second injection 1 to 2 months after the initial injection. And the third and final injection 4 to 6 months after the initial injection. If you receive the hepatitis B vaccine, you should be tested for the disease 1 to 2 months after the vaccine series to make sure the vaccination has provided immunity. If you are not vaccinated against hepatitis B, your risk of infection from a single needle stick or cut exposure ranges from 6% to 30%, depending on the level of virus in the infected person's blood. A higher concentration of the virus makes it more likely that you will become infected. Since you do have a chance of being exposed to blood or body fluids, you should receive the hepatitis B vaccine, preferably before you begin working with clients. Unless it is contraindicated by allergies, pregnancy, or potential pregnancy. The hepatitis B immune globulin, or HBIG, effectively prevents hepatitis B infection after exposure. Recommendations for post-exposure management of hepatitis B may include HBIG and/or hepatitis B vaccine. The decision to begin treatment is based on several factors, such as whether the source person is positive for hepatitis B, you have been vaccinated against hepatitis B, and the vaccine has provided you immunity against hepatitis B. Infection with the hepatitis C virus carries a great potential for chronic liver disease and can lead to liver failure, liver transplants, and liver cancer. Hepatitis C is a growing problem. The risk for infection after a needle stick or cut exposure is approximately 1.8%. The risk after a blood splash is unknown but is believed to be very small. However, hepatitis C infection for such an exposure has been reported. If you know or think that a client has a disease that is spread by airborne germs, contact germs, or droplet germs, you should use extra precautions in addition to the standard precautions we discussed earlier. Airborne germs can travel long distances through the air and are breathed in. Examples of diseases caused by airborne germs are TB, chickenpox, and shingles. To protect yourself against airborne germs, you should wear a mask. If the client has, or might have, TB, wear a special respiratory mask, ask your supervisor. A regular mask will not protect you. Remind clients to cover nose and mouth when coughing or sneezing, and treat the client's used tissues or handkerchiefs as infected material. Contact germs can cause the spread of disease by touch. Examples of diseases caused by contact germs are pink eye, scabies, wound infections, and methicillin-resistant Staphylococcus aureus. Precautions include wearing gloves, treating bed linens, clothes, and wound dressings as infected material. Wear a gown if the client has drainage, diarrhea, or is incontinent. And use a disinfectant to clean potentially contaminated surfaces. Droplet germs can travel short distances through the air, usually not more than 3 feet. Droplet germs can cause disease such as the flu and pneumonia. You should wear a mask when within 3 feet of your clients. The Occupational Safety and Health Administration, or OSHA, is a federal agency that guarantees rights to a safe workplace. Under OSHA's rules, you have specific rights because you might be exposed to blood or body fluids. These rights include employer-provided training about the hazards of working with blood and body fluids, and how you can protect yourself. This training must take place during working hours at no cost to you, at orientation, and annually thereafter. We also must have a system in place for reporting exposures to blood or body fluids. And we must also provide you with an opportunity to receive the hepatitis B vaccine for free protective equipment, and free immediate medical evaluations and follow-up if you are exposed to blood or body fluids. You also have the right to confidential treatment, and your medical records must be protected. Just as Jan and Bevs has certain responsibilities as your employer, you also have responsibilities as an employee. These responsibilities include, but are not limited to, always use standard precautions. Be open to new products or practices that could prevent exposure and protect you and your clients. Be immunized against hepatitis B, getting the series of 3 injections. Report all exposures immediately after cleaning and disinfecting the exposed skin or mucous membrane. Comply with our post-exposure procedure and recommendations. Know your own HIV, hepatitis B, and hepatitis C status. If you are positive for any of these viruses, you do not pose a risk for clients because you do not perform invasive procedures. Thank you for completing this training. To finish the course, you must take the required test. You have 2 options. Scan the following QR code to access and complete the test online, or complete the paper test included in your in-service training folder. Please make sure your test is successfully submitted so your training can be recorded as complete. Thank you for your time and your commitment to maintaining safe, high-quality care.